Hello everyone, I'm here this morning with Jill, our patient care coordinator, who's serving as our wonderful model, Rachel, who's our esthetician, who does a lot of our non-invasive treatments here at Integrated Aesthetics. And we're going to be displaying Ulthera and demonstrating how one goes about Ultherapy to help rejuvenate the forehead. Ultherapy is a highly focused ultrasound energy that we use to target different depths of the forehead tissue or facial tissue or even other body parts to help create more tone and structure and collagen in those different tissue layers. What you're going to see very shortly is Rachel do some drying on the forehead to help guide the Ulthera treatment, and then she'll also put the Ulthera transducer on, and we will actually be able to see the ultrasound of Jill's forehead. So go ahead, Rachel.
You could look straight up to the ceiling for me.
Once all the treatment lines and plan and everything is done, the forehead treatment typically takes about 10-15 minutes. The setup, the photographs, the consent, all that is done beforehand as well. Some of the things that we use to make the patient feel a little more comfortable, we can apply some topical numbing medication, we can give you some oral medication like ibuprofen. If you're a little nervous and you have a driver, we can also give you some oral medications to help take the edge off things. During the procedure, we can also be playing music. We use vibration or other distraction techniques to help get your mind off what we're doing. And again, the treatment is fairly well tolerated by the vast majority of people. I've had the treatment more than once already and found it to be tolerable enough that I've had it again and again. So this is the markings. If you go in a little bit closer, you can see where Rachel drew out the borders of where we're going to be treating. She drew out the crow's feet region where we're going to help treat around the eyes. She's drawn out the infraorbital boundary where the bone and the orbit lies right along through here as well to make sure that we're not going to injure the eye during the treatment. What she's going to be doing very shortly is applying some ultrasound gel on the forehead, and that's going to allow us to see deep to her skin and see what Jill's forehead looks like. What you can see here on the screen is the ultrasound viewing plate. I'm going to hand Rachel the transducer and the handpiece. And what you're going to see is, if you can see and appreciate this green line that's right across there, this is the surface of the skin. The green line signifies the depth at which we're going to be treating. At this case, it's 1.5 millimeters. This white line that goes across here, that's actually the bone. So you can see where the bone is, and we don't want to treat deep to that, but we do have 3 different depths that we can target for patients. That's 1.5 millimeters, 3 millimeters, and 4.5. The whitish part at the very top, that's the dermis or the skin, which you can see there. You can see again the strong white line right through there. That's the beginning of the bone. And this region right here, that's where Jill has her facial muscles, like the forehead muscles that help her elevate. So she would be a great candidate if we're treating at the 1.5 level and possibly at the 3 millimeter level to treat right above the bone as well. Those would be the 2 areas. Going any deeper wouldn't help her at all. We use this screen very much to help customize the treatment plan for every patient, for every region of the face, and we're constantly using the ultrasound to give us feedback during your procedure so that we can help customize and ensure that we're getting the best results. Thank you very much.